Often I get asked the question, when should a person do prolotherapy versus physical therapy? I'm trained as a physical medicine and rehab doctor, so I'm called a physiatrist. I'm a board certified physiatrist. And often a lot of our training relates to stroke. So obviously if somebody has a stroke and they need to learn to walk again, they should go see a physical therapist. And there's no doubt that physical therapy helps a lot of conditions. But you got to realize in the Chicagoland area, a session of physical therapy can easily cost $250 or $300. So if you strain your knee and you're an athlete and you get 10 sessions of physical therapy, that's costing somebody, and a lot of times it's costing the patient. Even with co-pays, it's costing them a lot of money. So is that strained knee worth $2,500 or $3,000 of expense? Often if a person would just right away go get prolotherapy, they would need one visit. One visit of prolotherapy for the knee in the Chicagoland area is about $350. Well, that's a lot less expensive. So I'm a very big fan of physical therapists. I have good friends who are physical therapists. I myself have benefited from physical therapy, but it isn't just every injury you should go get physical therapy. There are certain injuries, especially if an injury keeps recurring, and there's some muscle imbalance or this or that. Like, for instance, I had a stress fracture on my left side. I had a stress fracture on my left tibia, so my left leg got weaker. So I can either strengthen that left leg myself or get the help of a physical therapist, to get some specific exercises. That's all great, but I think we all should be somewhat cost conscious, and a lot of times prolotherapy is actually less expensive. And prolotherapy for athletes gets them back to their sport much, much quicker, in my experience, compared to the traditional physical therapy. And often athletes, man, they want to get back in the game. So if you want to get back in the game quickly, I would really encourage an athlete and somebody with pain where they can't do the sports that they want to do, get prolotherapy. It'll get you back, in my experience, the quickest of all the methods.